European Commission last week presented an exit strategy from the COVID-19 crisis, asking member states to coordinate the response. Euractiv spoke with the European Commissioner for Crisis Management, Janez Lenarčič. We asked him about when EU member states were warned about the pandemic, what went wrong in terms of solidarity, and what is next when it comes to crisis management in Europe. Commissioner, when did the European Commission inform EU member states to brace for a pandemic?
The European Commission President activated Commission's internal crisis management mechanism on 28th of January. And the day afterwards, the Commissioner Kyriakides and myself held a press conference in which we addressed the public in Europe and beyond about the seriousness of this issue.
Many member states in the beginning said they were ready, but a couple of weeks later, they reported severe shortages in ventilators, masks, etc. Do you believe that EU member states should have reacted earlier? What went wrong?
I would put it in the following way. We have called for preparedness since day one, since January. But I understand that most people believed they were prepared. Why? Because nobody actually expected or could expect the dimensions of this outbreak here in Europe would be so huge. I think that was the surprise for everyone, and it's not something difficult to understand, I say, because some recent previous experiences with outbreaks of coronaviruses were not so negative. We had the outbreak of SARS, we have the outbreak of MERS, we have more recently the outbreak of Ebola, and in all these cases, these outbreaks did not spread all over the world. So people perhaps expected that it would be something similar this time too. They thought they were prepared, but nobody was actually, and nobody could be actually prepared for a crisis of such dimensions. You know, when you have stocks of personal protective equipment for normal use, you run out of them very quickly when you are faced with such enormous challenge, and where you use them much more and many more items than you could ever have planned for. So I want to understand that this is really unprecedented. This is something that nobody actually expected when it comes to the dimensions of the outbreak. And that's why even those who thought that they were prepared were actually not prepared, because nobody was prepared for such a huge outbreak.
How did you feel when Italy asked other member states for masks and got no response?
I was astonished. I was astonished because until that moment, although there were some indications from some individual member states that they may not have enough personal protective equipment, we did not have the overview of the real situation, and that real situation became clear when there was no response. When there was no response, that means that no other member state felt it had enough of this kind of equipment for itself at that point. And that was the moment when it was clear that yes, something has to be done. And the Commission immediately started to work on it. You will remember that there were even some internal export bans introduced by some. The Commission worked intensively to have them removed. So to make the long story short, you are right. That hurt us all. The fact that Italy's request was not answered. But in a matter of weeks, the situation improved greatly.
According to you, when we will be able to say that we are back to normality?
We need some more patience, I would say, but I would not be able to predict when we would leave this crisis behind. What we can see is the experience of China introduced a lockdown of Wuhan and the Hubei province in late January, and it has started to remove the restrictions 2 months later. Certainly, it will not be enough to suppress the virus only in Europe. This virus has to be suppressed globally, otherwise it will continue to present danger for everybody.
Western Europe has been hit harder compared to countries such as Slovenia, Slovakia or Greece. Why did this happen?
This virus did not hit all EU member states at the same time. It didn't appear everywhere simultaneously. It appeared first in some member states, it was Italy, where it started to spread, and then it spread later. The problem with this virus is that it spreads really fast, it spreads far, it's very contagious, and most importantly, it is hidden. For much of the time, people were unaware when this virus already spread elsewhere. However, when they saw what is happening in Italy and later on in some other member states, some member states decided to introduce restrictive measures right away, and I think that was the right decision. And those were actually lucky because they did it at the earlier stage of the infection cycle. I think this was one key reason why the situation is different in different EU member states, because the infection cycle is different. It started earlier in some countries than in others. Second important factor that impacts the situation is, of course, how seriously individuals, people take the situation and whether how seriously they comply with the restrictive measure. That is also important to stem the spread of the virus. Lastly, and not least, it's also important how well functioning the health systems are. In particular, the intensive care capacity. There is need for such capacity during the outbreak, and those member states that have a greater capacity are doing better. And what I'm particularly pleased to see is that they're also helping others these recent weeks. Those whose intensive care capacity is overwhelmed are now having their patients taken care of in other countries where there is still spare capacity, and I think this is now a very good example of European solidarity, something that we have been calling since early days.